Attention. Welcome to the Different Spectrums podcast. We dive into the wild world of mental health discussions. Get ready for profound talks, a sprinkle of humor and sarcasm, and a touch of colorful language. Just a quick heads up, our show reflects our individual opinions, which may not align with the standpoint of the podcast, our featured guests, or any related corporate entities. Our mission? To illuminate through laughter and satire because everyone needs a good chuckle. Chill out and don't stress over the small stuff. Legal troubles? No, thank you. Cancel culture? Please spare us. We'd rather keep this space lawsuit free. So buckle up, have a good time, and join us as we navigate the vibrant realm of mental health on the Different Spectrums podcast. Today's episode is sponsored by BetterHelp. BetterHelp connects you with a licensed therapist who is trained to listen and give you helpful, unbiased advice. By using our link, you can get 10% off your first month of therapy. So, Naz, as a therapist on BetterHelp, what has your experience been like?
I've been doing it since January 2021, and it's been really fun and exciting. I've been able to reach clients all over the United States and the world. I've had good relationships. I've had folks that I've had for a couple months and a good handful where I've had for almost 2 years now. So it's magnificent. I've enjoyed my time and my clients. I love them.
Awesome. You can do it all from your phone or computer via phone call, video chat, or messaging, however you feel the most comfortable. Let BetterHelp connect you to a therapist who can support you all from the comfort of your own home. Visit betterhelp.com/DSP or choose Different Spectrums podcast during sign up and enjoy a special discount on your first month. All right, people, we are back again. This is what we call a sequel.
Sequel. Take two. Action two, credit two, scene two, movie two, season two.
Yeah, okay, we got two. Jesus. If you don't know, Dr. Lina Haji does not like the sequels very much. She's a little personal fact. She doesn't like sequels at all. She brings up Karate Kid 2 a lot, which
Some trauma
I thought
there.
was good. I thought was
I
fine.
thought it was fine.
Good.
Yeah.
It wasn't good.
I'm not saying it was great. I'm just saying it wasn't bad.
It was enough. Little Asian guy in there. Yeah, I mean, that's enough for me.
Hangover
Little
is
Asian.
not funny.
You know what? That's fair. I have to agree with that. It was the same movie again. Yeah. You know what? You keep bringing up these sequels, but then there are so many other ones. Anyways, let's get into it. Silence of the Lambs. We're actually going to be breaking down the scenes. And first scene that we have is actually going to be the first time that Hannibal meets Clarice. Hello, Clarice.
Hello, Clarice.
Anywho, back to it. Anyways, Hannibal meets Clarice for the first time. He's in prison, and just setting the scene itself. If you can't watch it, it's a very dark hallway, right? And then you have cells on Clarice's left. And as she's walking through to meet Hannibal, she sees this prison mate who's just like, I'm quoting here, I can smell your cunt, right? It's a quote. Yeah, that is a official quote. Somebody wrote that, by the way. And as she's going through, and then she meets Hannibal, and they have this dynamic where Hannibal is pretty much dressing her down. Like she barely even says anything to him at all, really, while he's dressing her down and pretty much telling her, hey, like I'm setting this tone right now. I'm the one in control, and you're going to be sitting there and you're going to be listening to what I have to say. And I'll be honest, Clarice is really taking this in stride. She's not really reacting to it at all, right? And that is something that we can talk about right now with Dr. Lina Haji, really about when you're speaking to these people who are in prison and you need something from them or you want something from them, they are in control. And the best way to really deal with that is to not give them what they want immediately, right? It's more of like a subtle manipulation, right? You're not allowing them to get the gratification of making you either wince or react to what they're doing. And can you speak to this working in these prisons? Like, have you had kind of these encounters? Obviously, not on the Hannibal Lecter side of things, but have you had these encounters where they're trying to get something out of you and you're just
Not flinch.
not dealing with it?
Yeah, 100%. So, there has to be buy-in, if you will. And I think that's with any kind of clinician, any setting, any kind of patient, client, individual, there has to be some sort of buy-in. Why should I talk to you? I don't have to talk to you. I might not even want to talk to you. What's in it for me? And that's kind of just human nature, right? So, but when you work in correctional facilities, and again, I don't want to oversimplify, but you have this concept of secondary gain, which is that a lot of inmates will manipulate, and understandably so. They're in the worst possible situation. They have their freedom taken from them. They have very little. They're told when to eat, when to sleep, when to do anything. And they have to live a very rigid, structured manner. So they're going to do what they need to do to get their needs met, whether that is pretending to be mentally ill because they have an addiction and they want psych meds, or they want to get the psych meds and sell them. Whether maybe they're a sex offender, they're trying to hide from general population to get into mental health. I've had inmates who have drug debts on the yard. People like to think, oh, they're locked up. How can they be high? There are more drugs in prison than there are in any ghetto in America. You can get your hands on anything if you want to. They just want to come to mental health to talk to a female. In Florida, because the prisons are so horrendous here, they only have air conditioning in medical units and mental health units. So when it's summer and it's really hot and the inmates need a break from the sun, just inhumane, and the inmates need a break from the sun, they'll pretend they're mentally ill to get to mental health because there's AC in there. So there's a lot of secondary gain. And so 90% of my job sometimes is weeding through bullshit, to be quite honest. Yo, doc, I'm hearing voices. And it's like, no, you're not. I just saw you playing basketball 5 minutes ago on the yard. Not saying people with voices can't play basketball. That's not what I'm saying, but you understand the gist. So it's sometimes it can be kind of a cat and mouse game, a little bit of I'll give you something if you give me something. And that sounds really horrible in the context of a mental health relationship, because you want to have this mutual respect and this mutual alliance and this trust. You want to build trust. But just like any other relationship, that takes time. So we see that perfectly in this scene, because Clarice needs information from him, right? She's trying to catch a serial killer. She works for the FBI. He has that information. He's knowledgeable. He's clearly probably a psychopath. And he has some narcissistic qualities where he wants to be in control. He wants attention. He wants to be wanted. He wants her to go after the information. So it's a very interesting dynamic. And like you pointed out, Spencer, she plays that role very well. She doesn't get frazzled. She doesn't yell at him. She doesn't say, you're the inmate and I'm the FBI agent. She doesn't play the power game. She kind of gives into it in a way where she does start to gain his trust. She even compliments his artwork. She kind of talks about how, the serial killer they're after, he collects trophies, but Hannibal Lecter did not. He ate his victims, and she kind of almost gives him kudos for that. So she's feeding into what, and it works. She's feeding into his ego and feeding into this grandiose idea that he has of himself. I think that scene is brilliant.
Yeah, totally. And I also think that it's good to note here that Hannibal was also a psychiatrist as well. So he knows kind of who he's in front of, but I think his downfall, like you said, is actually him thinking too much of himself. Like he is the number one guy, or you can't catch me, they caught him. But at the same time, even though he is caught, he feels like he's still in this place where no matter what, you're going to want something from me. So it's just a matter of time before you come to me and need something out of me. So.
Right. And like you said, he's not just Hannibal Lecter, he's Dr. Hannibal Lecter. So he has a set of clinical skills, and people have a misconception that psychopaths have a higher IQ or are more intelligent than the general public. And that's not accurate. The IQ distribution for psychopaths is actually very similar to the general population. So you have some on the and some in the middle, some. Yeah, it's a misconception. It's not that they're more intelligent. It's that they're typically better at manipulating. And that's what we see here with Hannibal Lecter. He's very good at manipulating. And despite the fact that he's in a single cell, confined in a maximum security prison on lockdown, he still thinks that he's in control, or he needs to let her know that he thinks he's in control. And in some ways, he kind of is.
You're in control because not only his intellect, but people like him or individuals even like me, just a matter of time before we win. So a situation will present itself where you will take advantage of it, whether it be an opportunity in life, relationships, money, a degree, a school, a job. There will be a moment in a client session. There will be a moment where they will show you something. And then that is the thing that you get to get them to the healing of the place that they need. So eventually something will expose itself and then you will, quote unquote, take advantage of it. So someone like him, I could see always being confident because, it's just a matter of time before someone falls for the trap. That's how I read it.
No, I agree. I think he's probably been setting traps his whole life and he's been successful with them until he got caught, which is how he got his victims. That's how psychopaths function through the world. They manipulate their way through the world. They take shortcuts. And that's exactly what he's doing. And she's savvy to that. She
also
gets
savvy.
that.
Yes.
Yeah.
Yeah. So it's a battle of these two very intelligent people. It's really a fascinating scene to watch because you're kind of like, you're invested. At least when I watch that scene, I'm invested. Like, who's going to have the upper hand? And they both, it kind of goes like this, right? They both kind of have the upper hand at different times during that scene.
She gives off that scared, jumpy vibe at times, and then she does jump the one time, and he's doing things to push her limits, and clients will do it sometimes too. They'll suss you out to see whether it doesn't matter who they are, what neurodivergence they are, but they'll look at you in a certain way, and they'll tell you something to see if you'll be disgusted. They'll tell you a trauma to see if you'll back away or be gross or be judged, or if you'll be like some of these white clinicians, right? I'm not trying not to judge, but it is what it is. Where they're like, oh my God, you poor baby. Where I'm like, keep going.
Right.
I mean, I've heard a lot of shit, homie. So you're not going to scare me. I've heard it all. And so she didn't jump, but he's testing her. He's like, sss. And I'm like, this motherfucker, bro.
She didn't jump, but she also didn't coddle.
Correct.
Me coddling therapists, and don't get me wrong, there's a time and a place.
Oh, I do it too, but time.
Supportive and hug and, not hug literally or whatever, but you know what I'm saying? There's a time and a place to be supportive and to be extremely empathic and to be there for your client patient. And there are times where our job, and this is why therapists who are always coddling are like the bane of my existence, because you're doing your patient a disservice. Part of our job is not necessarily to be liked. Our job is to help you to be the best version of yourself, right? And sometimes that includes calling you on your bullshit, and it's not always pleasant. And I'm with you. I think a lot of people like Hannibal Lecter or people who are high on psychopathy, they'll say things, for shock value, because they get off on that.
They get the reaction.
Right. And I've had some inmates do some really shocking things. I had one inmate cut off his testicle in front of me and there was blood everywhere. And and I didn't react. I'm
reacting to that one, G.
Yeah, no, that's just the truth. And I was just like, okay, is that what we're doing today? Because I'm not going to give you, I
remember Vicky was like, or maybe it wasn't a conversation with you. She's one of my homegirls that does, she's in the prison system too. She's like, yeah, this dude just fucking stabbed the one guy and just like pulled all his intestines out, just played in it. And she's like, this is what I walked into in the morning. It's like, girl, how do you do this shit? Like,
yeah, I have had an inmate who was an extreme borderline, but he was also pretty high on psychopathy, and he used to cut his stomach open, pull his intestines out, and throw him out on the floor.
Yeah,
I don't know how this guy's still alive because he's been doing it for years. He would get like airlifted out of the prison, stitched up, come back 2 months later, do it again. You're just like, funny enough, intestines are pretty. They can sustain a lot. Apparently you can just shove them back in the stomach.
They're very long. You have a lot of them.
Yeah, you have a lot of them. Yeah. And I'm not a medical doctor, so I couldn't speak to that. But she doesn't show fear. She shows a little bit of fear, like you said, Spencer, initially, like coming in, which is kind of normal. But she doesn't show fear. She also shows mutual respect. As egregious as this human being is, as horrible as the things that he did are, she still treats him like a human. She even, I believe at one point, she even calls him doctor. So the respect is there.
She does.
Right? So she knows what she's doing.
Yeah.
She calls
I
her
also
doctor
find
and
it.
sir a lot.
Oh,
Yeah.
sorry.
Yeah.
I just find it interesting that she's also a trainee. Like this is
A
like
puppy.
she hasn't been in this position ever. But her boss saw something in her to put her in front of Hannibal Lecter, right?
Yeah.
Something.
Yeah.
And that's the thing, right? And so he saw that maybe she can actually get it done because nobody else is able to get this done. So, and obviously it worked, because she's able to play into that role that not only makes her accessible to him, but then also something to where he actually is having fun playing this little game with her.
Fun.
Yeah, and he calls her on that.
Yeah.
He's kind of annoyed because he's like, the FBI sends a trainee. What do you
Yeah.
guys do? Like, do you know who I am?
Yeah.
And she takes that, and instead of becoming defensive and being like, yeah, I'm a trainee, but I'm almost graduated and I'm with the FBI and I was top of my class. She
Right.
says to him, well, then teach me something. So she puts the power back in his hands, which is brilliant.
Yeah.
Yeah, she's playing into it. That's why I asked you that question earlier. There's certain things that you can play into based on what people think of you. And you can use that against them in certain situations. And so me, as an autistic individual with a lot of trauma, you learn how to be a chameleon and watch and then play a role. And it's fun to play certain roles because they'll never see me coming. And when you see me coming, it's already too late because you suspect this one thing, that he's dumb or he's ignorant and he'll say this or that. But then you fall for the trick of me being highly intelligent and taking advantage of the situation.
Right.
And so my clients will fall in love with the bubbly version of me, the shit talker. The next thing you know, I change my voice and tone and inflection. And now I'm like, oh, now we're sitting and crying and in real emotions and having to push through some shit.
Right.
So I get you comfortable and then I get you towards the end. And it always happens. And the clients know it's going to happen. I remember being at St. Mary's out in Minnesota. And this is a thing that I would take all my students to because there was no one else to do it, but it was only for black men in the university level. And they were like, yeah, Nas, you ain't doing that shit to me today. I'm like, what? He's like, I ain't sitting next to you, man. You're going to have me crying and shit. Get out of here, man. It's like, come on, man. Just sit next to me. Like, I ain't fucking with you, man. It's hilarious. But everyone knows if you talk to me too long, I'm going to get you.
Right.
But
and you mentioned the word manipulation. And yes.
My boss doesn't like the word manipulation, but to me, therapy is a way to maneuver people to get them to a place.
Agreed. And I think, manipulation has such a negative connotation, and I get why your boss doesn't like the word manipulation, but at the end of the day, it's also a clinical skill. It's a clinical skill, and it's a clinical skill that ultimately is designed to benefit the patient, which is the bottom line, right? So whether you call it manipulation, motivational interviewing, cognitive
behavioral therapy,
reframing, whatever it is, I mean, it doesn't matter what we label it. The point is it's a skill that's put in place to ultimately benefit the patient, at least in a therapeutic setting. Maybe not in this particular scene, because but they don't have a therapeutic relationship.
No.
Right? This is a criminal investigative type of relationship.
Right.
It's very different. But yeah, it's
I'm trying to give people the introspection of what it's like to be like the neurodivergent and either deal with trauma and be able to maneuver people, because you are putting things and using your coping mechanisms or your defensive skills to make things calmer or more relaxed, or to appease people, to be funny. Are you the wise person that had to become a clown so everyone laughs because everyone's like traumatized and like angry and upset? Did you have to be the soft one or the caretaker, right? Did you have to be the violent one because you couldn't get any attention? Like, who did you have to maneuver to be? And so then you sit down with me and I start to break those things. And I start to get you to really look at who you are and what you're doing. And so the autistic folks, it's hard. And there's a lot of borderline personality disorder in that, because a lot of it's identity and ego strength. Who are you? So you deregulate and a lot of shit happens. Self-harm happens, suicidality. So it's hard to segregate some of these things. But when you're looking at homie, that's what I'm going to pivot to this. The question that we talked about earlier is, it is so fun to have an opponent, a client that's like on your same level, but it's also very tiring because I'm like, fuck, man, this sucks. Because you're constantly reacting, and like a boxer, you're countering everything that they're doing. And both of you are countering, and it gets very tiring in this boxing match. It's like, this fucking sucks, but it is fun, especially when you finally get them. And sometimes I'll look at them, I'm like, I got you, fucker. And they're like, damn, you're right.
One of my best friends is a clinical social worker in the prison system, and she loves working with antisocials. And I'm always like, you know, I enjoy antisocial personality disorder and psychopathy as well, because it forces me to be on top of my clinical game.
Yeah.
And it's like it's a chess game, kind of like we saw in that scene. It's
Yeah.
really a chess game of like, how, like you said, it's maneuvering.
Maneuvering.
It's maneuvering.
Yeah.
That chess
I
game, I
saw a
can't.
meme the
Go
other
ahead.
day. Sorry to interrupt. I saw a meme the other day that said CBT is just gaslighting yourself, and I was like, yeah, that's accurate.
Facts. Yeah, bro. We call it a bunch of shit, but in the end of the day, what are we doing? We're hustling people into getting out of their own fucking way.
Correct.
What we're doing, and
That's what we need to remember. No matter what we call it, if we have to remember this in a therapeutic setting, that is, it's for the patient's benefit. It has to remain for the patient's benefit, and sometimes that doesn't feel good, and that's why coddling therapists, over coddling therapists, they really, therapists who co-sign their patient stuff all the time, you're not doing your patient, you're doing your patient a disservice.
Yep. You're enabling. And also you're insecure about your own abilities and skills, or you just don't have them, and thus we just sit and support. So we see a lot of these social media folks, therapists, and it's the same shit over and over. And you call this shit out all the time, and I love it. And so does Dr. Mack. And I'm like, that's when I get on my bad bitch face. Like, yes.
Got those nails on.
Yeah, like some of these therapists, bro, I'm like, y'all not helping no one, man. You just affirming horrible shit.
Your job is not to be liked.
Correct.
A lot of my clients have hated me, hated my guts, and then thanked me a year or 2 years down the line.
Preach.
Or never thanked me. I'm not in this to be thanked. And it's hard. It's not always easy. It's not always easy to be disliked by your patient, or, or cursed at by your patient, or F you. And, that's not always fun. That's not nice. I don't enjoy it. But that's not my job. My job is not to be liked. My job is to help you help yourself.
Correct. And let's get to that. So, Spence, we look at this scene.
Mm-hmm.
Me and you were laughing and teasing her earlier, but I feel like she would be like a kid in a candy store if she was sitting in front of Hannibal. Obviously, his ass completely locked and chained behind them bars. But otherwise, you'd be like running. You'd be CrossFitting his ass.
No. I wouldn't even want to do a cell where like you could put your hand through.
Oh, hell no. I'm gonna be real with you.
That's why he's in the glass.
No. I ain't even going into the prison, bro. I can't do it. Can't do it. No. Because they're going to mistake me for one of the inmates. Can't do it.
How'd you get out?
No.
Wait a minute.
Her ass, her ass, they're like, oh no, girl, you don't belong here. My ass, they be like, get your ass over here.
Yeah.
I wanted to say a slur, but get your ass over here, boy.
2258. 2258. Come on, man. Come on.
Jesus Christ. Don't be traumatizing people here with numbers. But like, would you really enjoy to be like pick his brain and just sit there and play chess?
I would love it. I would love it. When I was training in California, I was supposed to have I have worked with famous serial killers, which obviously I can't name them for HIPAA purposes.
Yep.
And it's so fascinating to me. And people are like, why do you like that crap? And I'm like, I don't know why I like it. I just know that I do. And this is where I belong. And to me, it's just fascinating. I was supposed, when I was training in California, I was supposed to have a meet and greet with, not a meet and greet, but
a meet and greet.
Can you sign this?
Charles Manson.
Oh, wow.
Yeah, I know.
Big one.
Yeah. And then he selfishly went and died,
I know.
Yeah.
She's got what we call a mind stiffy.
Oh, a mind stiffy.
I'm going to let people stew on that visual.
Yeah.
Yeah, a mind stiffy.
I also find it fascinating that, everyone who is good at being a therapist can draw that line, and they could be kind of like Hannibal and use it for bad, and that's where I think people get a little bit irked at, is because you're inside of my mind, so quote unquote inside of my mind, and you can all the things that I fear, that I hate, and you can use that against me, right? And that's where I think people like draw the line with therapy, because they think that you're going to use that with malintent.
And that's fair.
And that's the thing, and that's why really gaining the trust and things like that, talking about manipulation, but it's a good manipulation, like you were saying, but at the same time, people don't want to feel that way.
It's scary.
They don't want to feel like they are being taken advantage of, even if it is for good. They might not want to feel that way. And so that's the problem, where I think some people might be having it But at the same time, I think it's also just having great conversations and being able to talk to people and leading to what are the actual issues that are bothering you and why are you even in this office,
Right.
that can really go a long
I
way.
mean, the ultimate line is the ultimate fact is for therapy to be effective, you have to be vulnerable.
Mhm.
And you're like entering an office as somebody that you don't know. And that's why it can be really hard building rapport with victims who have a trauma history. And who can blame them? I wouldn't trust you. It might take a long time. But you pointed out sometimes it's not about what's in the textbook. It's not about the CBT. I've had sessions for 1 hour talking about playing basketball or the weather or whatever you got to do.
Yeah.
And that's why I'm always so hell-bent on indicating like you have to individualize evaluations and treatment. Diagnosis is important. It's a tool that clinicians use. I find diagnosis to be very important, but I've never met two people with schizophrenia who are the same. Two people with bipolar disorder who are the same. Two borderline personality disorder people. Nobody's the same. You know what I mean? And yes, we have modalities and we have tools and we have structure and we have things like that. But if you don't individualize treatment and you just put everybody in a box, you're not going to get
You're gonna
anywhere.
screw it up. You're
Yeah.
gonna screw it up.
Yeah.
When it comes to this stuff that we wrote down in pre-production, so he tries negging her, right? And then she feeds into it and this and that. So we get into that, but he's also very charming for a lot of people, especially, don't get mad, but in the prequels, in the Hannibal prequels, right? He's these doctors, sophisticated, everyone loves him. He's highly intelligent, magnificent practice that he has, right? He's the special counsel for the police and the FBI. And so we see this grandiosity and this charm with a lot of folks. I've had a couple antisocial folks come in, and some of the interns had to get them after working with me. And some of the interns are like, oh my God, he's just so nice and charming and kind. And so my boss is like, we go into case management. She was like, so that's a fucking sociopath. She's like, oh my God, he complimented me. I'm like, yeah, dude's fucking terrible. And like choking and beating his girl and other women. And like, dude's like fucking legit batshit crazy. But also plays the victim and all that shit. Shit was wild.
Oh, yeah.
Love talking to him because I got him to break a few times. But then again, I'm like, did you actually break? Or are you just faking it to get something? I don't fucking know. But it's fun for me to push buttons because I'm like, where is this going? I've only had one to three. There's a couple other folks who I'm not sure if it's sociopathy, if it's these other things. There's a lot of stuff getting in the way. So this charm thing, is that for real? Are a lot of folks that have this sociopathy, are they charming or no?
Yeah, so psychopathy is like a certain what psychopathy is. It's not a diagnosis. It's not in DSM-5. It's really a construct of personality, right? And the PCLR, which is the gold standard psychological test for a psychopathy, the psychopathy checklist revised, which was developed by Dr. Robert Hare, who's like the guru in psychopathy. It has 20 different items, and that doesn't mean every psychopath has every one of those traits, but usually those are the traits found in psychopathy. And one of them is grandiosity, charm, deceitful. Some of them are grandiosity, charm, deceitfulness, shallow affect. So I have met some, you look at somebody like Jeffrey Dahmer, he wasn't exactly charming. He didn't have that personable kind of, he didn't see, at least, I mean, we never met him, but he didn't seem, you can tell from the interviews and documentaries, that he didn't seem to have that like gregarious, personable, likable kind of factor, but he was still obviously a psychopath. So I think some do and some don't.
So it's a spectrum.
I think, yeah, it's a spectrum, and just like any other disorder, you might have some of the symptoms, you might not. And I find that Hannibal Lecter, even if you don't like him, he does have that charm factor. If you notice his prison uniform is meticulous. I mean, it's tucked in, it's ironed, his hair is slicked back. He has the piercing blue eyes. His cell is intact. He's got a certain quality of charm, especially when you compare him. And I think the producers of the movie did a really good job with this, to the other inmates that are down the line who are kind of disheveled and all over the place. And one of them is possibly psychotic or, sexually preoccupied, if you will. He's different. Yeah. So, to me, he has that charm. He does have that charm.
I'm gonna ask one or two things, and then we're gonna get out of here. So I think he's also got this mentalist factor to him because of intelligence. Spence, you know that guy that gets really famous now. That's like in athletes. He's going into all these football things. And he's freaking people out because he can figure out
The
everything.
magician guy, yeah.
Yeah. So right. So now he does that too because he's able to break her down based on all these subtle cues.
Mhm.
So the reason why I bring this up is because we're talking about autism. Some of us, not all of us, but some are oblivious, and then some
Okay.
are also like me, where we take in about 1 million different data points to assess things. Some of that's built out of trauma. Some of that's also built out of being autistic and trying to figure out the algorithm for humans and how to operate in this world and have social conversations. So we're taking things, all these micro expressions. And so he does that.
Yes.
And it's magnificent. And I love doing that as well, too. So you can size people up pretty well. So I'm going to pivot over to Spence. It reminds me of Homeboy when we went to fucking that Harry Potter thing, bro.
Oh,
that
yeah.
motherfucker was a mentalist, bro. And he was autistic, but
He was.
and he sized us up and told us exactly who we were and the wand of Harry Potter that we was getting.
Yeah, they do a great thing. If you go to Ollivander's and you go in to get your wand, and then they have these different people that work there that just size you up mentally, and can really just go by
It's
and
like
they
three
go by your
questions.
name. They go by your name. I think your date of birth.
Yeah.
And there's something else. I
Maybe
forgot
it was like
what
where
I
you're
think it was like a
from or
question.
like where you were born.
Yeah.
It's like 3 things. And he'll fucking size you up immediately. I'm sure he's also
Yeah.
taking other data points, size,
Sure.
weight, color, ethnicity, the people that you're
That
with.
guy was good. Like, I don't know how good the other people were, but
The
that
guy we got?
was good.
I was
Yeah.
fucking sobbing, bro.
sized us
Sobbing.
up.
Spencer started fucking crying. I seen him cry like twice in
Yeah,
fucking like
yeah.
7 years.
It's
That's fascinating. He should go into the field of mental health.
Bro.
He
Or
should.
he start murdering motherfuckers and eating them.
yeah,
Sure.
he could be licked.
A motherfucker could have been.
He
Killing
could have been.
motherfuckers after he gives them the
He's
wand. There's
in
a tracker
Florida,
in it.
so hey, I'm
Hey.
sorry.
Yeah.
Yeah.
Right.
Where this wand is made out of other people's bones. That's how he gets rid of the evidence.
I was like, take this one. Like, why?
Take this one. Why this one? Why does this one got meat on it?
Why is it sweaty? What does that mean?
I can smell your. I'm not going to say the other word.
No,
Um,
but like they do
wow.
a great job, and that guy was
Magnificent.
amazing. Yes,
Some people
yes.
have a gift
They
to intellectualize everything almost instantaneously.
Yeah.
And the more you do it, the more you get used to it. So the more clients that we see, and you know this, Doc, is that you start to get this schema or this algorithm, and you start to
Yeah.
get a sense. You can pick up on things very fast.
Yeah.
And so people come to my office and are like, wow, you understand everything about me within like 10 minutes. Well, I've seen like
Yeah.
500 of you.
Yes. I was testifying in court once, and the attorney was trying to, get me because the guy, it was like a competency to stand trial, right? And the guy was malingering. He was full of shit, and excuse my language, but I found him competent to proceed, right? And so his lawyer was like, oh, well, my client told me you only met with him for 20 minutes, and I was like, that's correct. That's accurate. Like, he thought I was gonna be like, well, it was actually more like 40. Like, no, it was 20 minutes. That's accurate. And he was like, do you really think you can figure out if somebody's competent in 20 minutes? And without sounding like a narcissistic egomaniac, I was like, yes. You have to be confident when you're on the stand. You have to stick to your opinion. I was like, absolutely. And he was like, well, what makes you say that? And I was like, well, number one, again, without sounding like a narcissistic egomaniac, I have 2 master's degrees and a doctorate. I worked in prisons for 20 years. And one of my specialties is malingering. And I don't want to run down my resume, but like, also your client is not that sophisticated. And when he told me that he saw little green people running around, I knew that he wasn't schizophrenic, because that's not how this works. So, this lawyer was trying to come at me like, you only spent 20 minutes with him. And I owned it. I was like, that is correct. And I actually knew he was full of shit within 45 seconds. So there's that.
Quick. The studies are done also on people of color that within a few minutes, actually the studies checks to show within seconds, we can tell if someone's racist or not. We have
I love
the studies are done that within a few seconds, we have the inclination already like,
No, I need you to send me that.
you one of them. Yeah, I can find it. You one of them. And it's like, oh yeah, 100%. I was like, every person of color I know, like you can always tell. A woman sees a dude that's
I believe that.
misogynistic. Like you can tell
I
immediately
believe that.
by the way they carry themselves, the way they talk to you, the inflection,
I
the
believe
tone, their posture.
Yeah.
You can just tell on how people look at you. I can tell today at work when I look over, I say these setup things because I love manipulating people, and everyone thinks I'm just being, I'm going to say it now, retarded. And I'm doing my thing and shucking and jiving, right? But it's a setup to get you to be disgusted by me because fuck you, I hate you as administrator. And so now I'm playing games. Now I'm making people miserable. And I love it. Everyone else is having fun. Administrators are like, this motherfucker. I just talked to him yesterday and told him not to do this. And I'm like, you know what?
Yeah.
Meth.
The blue stuff.
You know what?
Right.
I told the doctor, let me get some of them purple pills, motherfucker. Let me get a couple of them blue ones too, though.
The blue ones. Get you right.
And get you right. I said, take some of them blue ones and the purple ones together now. Have a good night. This is all in public in front of like 50 therapists and like a bunch of psychiatrists.
Like, yes. And they're all taking notes like,
Admin's
keep
like,
going.
yep, you're not getting your raise. You're not getting your raise. I'm like, yeah, fuck you. I hate you and I hope your kids lose their legs. So
Jesus Christ, man.
That was a throwback for Ricky Bobby.
Is it though?
Is that a Ricky Bobby reference?
It was.
It was.
I hope you have sons. Beautiful, articulate, athletic sons. And I hope they get their legs taken away. I hope you feel that pain. I hope you feel it. He did say that.
Good.
Yep.
Yeah, thank you.
Magnificent, man. On that note, let's mosey to the second scene.
I had to do some editing. So now this is the one that you chose, the transfer of Hannibal. It's that classic where he has that mask on, or has the like his own grill, like a football grill on there. And yeah, it's just they're transferring him because in order for them to catch Buffalo Bill, they need information from Hannibal, and he won't give it unless he's transferred to a different prison. And also, like, the senator needs to answer questions, or else they're not going to find her daughter, who Buffalo Bill actually kidnapped. And he asks some very sexual, very
questions.
Yeah, like it's
leave it at that.
Yeah, very sexual question.
Provocative and inappropriate.
Inappropriate, provocative, and then also just really trying to minimalize her, right? Really trying to make her
like
feel
degrading.
Degrading. That's a good word. Yeah. So he's really trying to degrade her, even though she's this senator and she holds this high position in government. He's like, well, you need my information, or else you're not going to find your daughter in time, and she's just going to be part of like another skin suit. And so it's true.
Hey,
it's not even a joke.
My last couple girlfriends. So
cocoa butter.
It was black.
And so now he's in this position at this airport where he's vulnerable in a way physically, but mentally he's in control. Yeah.
So I picked that scene because it's like the first scene, but on steroids, right? He's in a old school straitjacket with like his arms. He's literally on like a dolly, right? He has that grill you talked about, like that's we have spit masks in prison, but this is more than that. This is like a plastic, like you're not going to bite anybody type. I mean, he's completely dehumanized physically, and there's nothing but cops and FBI agents and politicians, and it's in like a airplane hangar, right, or something, and they're transferring him, and he's still in control, which is fascinating to me because he holds the information. He wants to transfer to another prison, and they're giving it to him, and even though he's physically incapacitated in every sense of the word, besides he's still conscious, he holds all the power in that scene. And to me, that is the definition of, high psychopathy. So that's why I chose that scene, because it's just fascinating that, like you said, you have this, well-dressed, attractive, powerful, respectable senator who's, she can say whether or not he's going to the other prison, and yet he's calling the shots.
Interesting. You see, so some of us that are autistic really don't give a shit about hierarchy. And so I'm not saying that he's autistic at all. I'm just paying attention to something that we talked about on the One Piece episode with Druids, is a lot of us don't care about hierarchy. And so we're on the same playing field. So I don't care who you are, what you represent, what money you have, what TikTok followers, you ain't shit, I ain't shit, let's talk, let's sit down. So a lot of our conversations are much more humble. Sometimes they're braggadocious, but everyone's on the same field. And some of us have a hard time respecting authority, or especially if we don't fully trust you or have buy-in or respect you. Some of us are too rigid and we can lose respect almost immediately for someone,
Right.
Based on their intelligence levels or their meticulousness. But it's interesting with him is his distaste for hierarchy, also because I assume because his supreme intelligence. The reason why I like this scene is because something that I referred to in the beginning is the way I was trained by my father is only a matter of time. We're playing the long game, kid. And we've been fucked since day one, so we're going to play the long game. It's a matter of time before what we want happens. So you just got to buy your time, do what you need to do today. It's the same thing in athletics. Do what you need to do today to win tomorrow. We ain't worried about the game on Sunday. We're not worried about next season. We're not worried about college scholarships. You got to go in and get this lift in. You got to go in and get your creatine and your protein. You got to stretch and you got to sleep and you got to visualize. You got to do your homework. You got to sleep and you got to eat. You got to drink a shit ton of water. You got to seek consultation. You got to talk to professors, talk to disability services. You need to talk to your therapist, get your meds. You need to do everything you need to do today to make sure you pass the test. So eventually you get your degree and you can go do shit. So that's how I train my students. It's just a matter of time. You may be in prison now, but you'll be free soon. And what you need is your education. With my autistic kids, you may be in prison now with your family because your identities, because you're gay, queer, trans, you're autistic, they won't accept it, they won't give you therapy. And now you're imprisoned. But soon you won't be. And then you got no excuses. Now you need to go do what you need to go do. So are you going to be the victim after you graduate? Like, what are we doing? So me as your therapist, I sell people on this thing of hope. Matter of time. All of us, some of us get really fucked up poker cards. Like we get really bad set of cards.
Yep. I deal with that a lot.
We get bad set of cards. And some of us work with those cards, bro. I can be ashamed of it. My father used to be ashamed of, he doesn't like me talking about certain things back in the day because he doesn't want people to think different of me. He wants them to see me as respectable and intelligent. Like, nah, man, I'm hood as shit. Is what it is. And we come from gutter shit. Is what it is. I'm proud of it because I want you to know that I've done more than you. I want you to know we're not on the same playing field, homie. Come way further than you. And we're at the same playing field. To me, it's like a grind thing. So I like people to know that because I like to set that precedent, but besides the point. So my clients, I'm not teaching you to have shame of your mental illness, your disabilities, your ADHD, your dyslexia, whatever it is. We're going to accept some shit. We're going to work with it. And then we're going to surprise everyone because we're going to just keep our head down, do what we need to do, and we're going to win. I teach people to win when it comes to racism, misogyny, any of it. But the thing is, I never get to tell them a time frame, doc. I don't know if it's going to be a couple weeks, couple months, couple years, 10 years. I don't know if they're going to deal with all this horrible shit when they graduate of racism and sexism. I don't know. It's a matter of time. And so I see this scene as someone that is just waiting in the wind. And eventually it'll be his turn. So eventually it was his turn. He gets out and now he's like, hey girl, how you doing? Don't come looking for me because I'm going to kill you, bitch. You know?
He got transferred to the worst prison
I know.
ever. Like the best prison for him, obviously.
Yes.
All those cops.
Yeah, like they only had 2 guards.
No.
So how did he know that? Did he know that was like a shit low max, low security prison?
He
Like, I don't know.
did. Yeah, of course he did. There's no way he didn't know. He was like, oh shit, they're actually pretty lax over here.
Yeah, because he wasn't in Memphis. He's like, let me go to Memphis.
Yeah. Like that's why he wanted to get transferred there.
Yeah.
Because it was so relaxed, right?
Yeah.
And
he
it
knew.
was like 2 prison guards and they're in the cell with him. That's like day one shit. Don't get in the cell with them while they
slide
have their
that
hands
shit
free.
under, bro.
Even if their hands aren't free, you don't get in the same cell as them.
No. I mean, there was somebody who's worked in prisons for so long. The amount of security breaches in that scene were like,
intense.
Oh, but
you know, hey, but white men, we trust white men though, so that's probably why they did it. You know, I'll go in the cell with him. He's a good white man. You know,
cuffed him.
A black guy, they're like, we're gonna beat his ass, then we'll throw the food on your head. Then when you wake up, you eat it. Jesus. See, Doc is like, yep. So she's like, I'm not wrong.
I mean, Kyle Rittenhouse.
Yeah. True.
There's a lot of white folk that get treated very nice.
Yeah. Which is amazing. But like take just reality, right? Take reality out of the scene.
Yeah.
You have a guy who is a serial killer who eats people.
Right.
And you're like, we'll be fine. We'll be all right.
Let me look away and not be hypervigilant.
Yeah.
Yeah, that scene was annoying from that perspective, because
It's a flaw.
yeah, I mean, and then also the fact that like the first time we meet him, he's in that super solitary confinement with the plexiglass, and it's like super, a guy like that, you don't even get paper to draw, and I'm not saying that's okay, but
yeah,
there was
there's a couple fallacies in it.
Yeah.
Well, and I know it's because he has information and they want to treat him so that like they'll treat him so that then he'll give them the information,
right.
But at the same time, you should probably also be a little cautious,
Hey, remember though, I mean, people keep coming at you. Eventually they're going to fuck up. Just a numbers game. And then that's when you pounce. Whether there be finances, money, opportunity, whether it be in football or sports or athletics, you're not always perfect in every play. And that's when you get a sack. That's when you get a fumble. As you try to be not perfect, but you try to practice this permanence. So that way you just keep doing your job, and then eventually they'll fuck up and you take advantage. That's athletics in a nutshell. That's also life sometimes too. Just keep showing up.
He knew that. And also you have to remember that, like, people who are incarcerated, they have nothing but time.
Nothing but time, boy.
And so he's a doctor, he's highly intelligent, he's psychopathic, he's manipulative, and he's locked up.
Plenty of time.
He has a lot of things in his favor to plan something like that.
No.
So, you can't underestimate the fact that if you're locked up 24 hours a day, 7 days a week, you have nothing to do but have
plan,
observe. You have sensory overload because that's all you have, right?
It's fun observing people too. If you actually sit down and watch people and you start picking out tendencies, it's actually kind of fun. You go to a football game, but I don't know, maybe that's the sociopath in me. I'm like, look at these motherfuckers, look at these humans, these motherfuckers. I eat them. I tell you that.
Couple McRibs over there. You know what I mean? How'd he do?
I told my dad that every time we said the 30 things that I just thought of Big Macs, he's like, you're so autistic. Like, why would they be Big Macs?
Exactly.
I don't know.
McRibs.
No, McRibs are the feet.
The toes of McRibs.
The toes of McRibs.
Oh, right. You did say in a plastic bag. That's right.
Yeah,
the lady parts.
The lady parts, the 30 lady parts would be like a Whopper with that wrapping on it. I don't know why they have that wrapping.
Big Mac, because McDonald's beats Burger King.
Sorry. That's a fact. But, I'm sorry.
McDonald's is so delicious.
But Burger King, you could taste the grilled meat, So I like that in my
I like the charcoal. I like a char bro.
I like to taste the meat. Oh my God.
All right. Anyways.
Last scene, bro.
Yeah. Actually, yeah.
If you got more, go ahead.
No. This is good. All right. So
oh God.
We have our first meeting of Buffalo Bill.
Hey.
Great man. Is she a great big fat person?
You like butter or no?
It's so good.
You like butter?
Doesn't he say something about butter? You said or butter?
You see, you're just hungry. He's like, she puts the lotion on the skin, or else it gets the hose again. I don't like how my eyes got a little shifty there for some reason.
Can you give me a little tuck? Give me a little tuck.
Trying to get into character. But yeah, this is our first time meeting Buffalo Bill, and really, I mean, there's nothing to, like, the background between Buffalo Bill, like they kind of talked about it already, but a good side note also for this is that he believes that he's also trans, but he was deemed too violent to actually have an operation for it, which I found so I found that pretty interesting. And so we get this character who's taking his victims and he's taking parts of like their skin and he's trying to make this suit to one day wear, and he's dancing to the song called Goodbye Horses, and I love how that song is just, it's it's just coincided with that movie
Yep.
for all these years now.
Yep.
Like every time you listen to it, you're just like, I need to tuck.
Oh my God.
Yeah.
I didn't think that.
I need to put them away.
I need to put them away.
Yeah.
Where'd they go?
But I would love to know. So we have these differences, right? We have Buffalo Bill, and then we also have Hannibal. One's very meticulous and well thought out. The other one is a little bit more in the moment, I would say, and a lot more just going by. He doesn't have a plan. He's really just going by like the skin of his teeth. And if he gets caught, he gets caught. But at the same time, he just hasn't. So in your mind, what are the big differences for you with Buffalo Bill and then Hannibal? And have you seen these kind of two different styles of like a serial killer or just a psychopath in real life before?
Yes, I have. And I think it's fascinating. I think, like Dr. Nas said, psychopathy, just like any other disorder, it's a spectrum, and it can present very differently. And yeah, Buffalo Bill, he's kind of disheveled and he's putting on makeup, but it's not like well done. And
I'd
he's
fuck
just
him.
like scribbling.
Sorry.
I'd fuck me so hard.
So hard. I'm sorry, Doc. I'm so sorry.
We're so sorry.
I'm sorry. We just threw you off.
I had to do the voice too.
You know what I signed up for. And he's like, yeah, he's more like, he's got this like 80s androgynous vibe, and he's kind of free flowing and putting on the makeup all messed up. And he's so different from Hannibal Lecter. They're like complete polar opposites, but yet you can kind of see the psychopathy in both of them. And that's why it's so interesting. And like I said before, no two disordered people, I don't like to label people with their diagnosis, but for the purposes of brevity, no two schizophrenics are the same, no two bipolars are the same. Like that's not how it works. People are still humans and individuals and have their own traits. And so what's a common misconception, especially in like Hollywood and movies, is that psychopaths and serial killers tend to be very well planned. Whereas in reality, they usually have a lot of impulsivity and poor behavioral controls, and they don't have long-term realistic thinking. And so I think Buffalo Bill is actually probably a better accurate description of, what we tend to see in psychopathy. That being said, we also have some that are just like Hannibal Lecter. I mean, look at Ted Bundy. Ted Bundy was kind of a little more erratic than he was presented as. I mean, sounds like he struggled with alcohol, and he was kind of jumping from place to place and parasitic living, and he was, didn't know how to really live his life in a proper manner. But he was planful when it came to his victims to some extent. He had a certain type, and he knew how to like check the houses, and he got away with it for a long time and went from like state to state and just kept killing and killing and killing. So whereas Buffalo Bill is just kind of like, like you said, in the moment, kind of erratic, irresponsible, no long-term plan. This is what I feel like doing, and so I'm just going to do it. Kind of more infantile, and we can tell in the movie that they're both psychopaths. We can tell, but they're vastly different. I love that.
And he was Dr. Hannibal's patient at one time, right?
Yeah, Spence? I think so, right? Or his friend. I don't remember.
It sounded like either his boyfriend was, or
I think I think Hannibal knew the person, like another serial killer, and then he was connected to Buffalo.
Correct.
I think that's accurate.
Yeah. And I also love a part that like with Hannibal, you can also see the difference. Like he's very well kept, neat,
meticulous
OCD. Yeah. And then you see Buffalo Bill, he just has like a whole
grunge.
Yeah, in his basement where he puts his
hair is like stringy, and like he's just
That was also like I think the hair was also like
it was
like
hers.
A skin. Yeah, it was a skin cap. Yeah.
Oh yeah, that's right. That's right.
It was a person's.
Yeah. Oh my God. Yeah.
It's a woman's. That poor girl. Yeah.
But it's like a mat. It's like not.
Yeah, girl, do your hair, girl. Well, that's girl 101.
Yeah. Damn, dry ass hair.
Get some product.
Yeah.
Like I feel like hair may die if it doesn't have actual blood to feed it, though. So maybe that's why.
Yeah, well, it's a scalp.
I don't know. I don't know how that works. I don't know.
Yeah, he's a
We can
mess.
find out.
I know. I mean, as soon as I saw the nipple rings, I was like, yeah, psychopath.
Yeah.
Psychopath.
Nipple rings doesn't make you a bad person.
Oh,
All right.
okay. Well, I want to see the studies on that. So, bro, I'm gonna be real with you.
Yeah.
Doc, have you ever, and Spence, have you ever made the joke and like done the dance where you're dancing with the skin suit, or have you never done that dance?
I'm gonna plead the fifth. Yeah. that
I've
line
definitely
is
said I'm gonna wear you as a suit. I've definitely have said that many a times.
Do you say in the voice though? That's what really
Not in the
makes a
voice, because I don't know the voice, but like, you ever love someone so much you just want to crawl inside their skin and then just like kind of wear them as a suit, and then they're like,
oh, that's so creepy and romantic at the
I know,
same
it's like how
time.
much I love you, right? Like I wanted to wear you.
a level of intimacy.
That's a level of intimacy you'll never know.
Never ever.
I just want to shrink down in size and live in your blood.
Oh my. All right, Ant-Man.
I want to be in.
Oh,
I want to be in. I want to be one of your erythrocytes. I don't know.
My God.
I want to be in the blood cell thingies. The mitochondria. I want to be in your mitochondria, girl.
I just love how Dr. Haji's just like, oh, like he's just such a
He's such a budding psychopath.
a dark romantic.
Yeah,
It's like-
it's a dark room. I get what you mean though. I
get
feel like that's a kind of
I stole it from a show. It was Courtney
Well,
Cox.
I like it. I like it.
Courtney Cox said it in Cougar Town and she said this towards her son.
Oh.
Yeah, so that was actually very funny, very
Wait,
provocative.
now we just crossed into the extra pathology line.
Well, I mean, hey, she loved him, and she would say all this really pseudo-sexual shit, and he'd be like, "Ma, shut the fuck up." It's hilarious. Cougar Town was awesome.
It was actually a good show.
So now that we're back,
Yes. Look at that. We're back again.
Spence,
Mm.
who creeped you out more?
Hmm.
Like Buffalo Bill or Hannibal? Like they're both extremely fucking creepy, bro.
That's a really good question.
Yeah. I would have to say Buffalo Bill. Actually, you know what? No. I'd probably say Hannibal because you know what you're getting with Buffalo Bill, right?
I feel like you
Face
don't know
value.
what you're getting.
No,
Yeah.
you know,
No, I
you know.
agree. I think he's more face value.
I think you know exactly who he is, and that like you're gonna get 100% of that, like that scene. You're gonna get 100% of that. With Hannibal, on the other hand, he was killing people for years, and nobody knew, and he was likable. People knew what he was. With Buffalo Bill, you could tell, like there's an instinct where you're just like, this guy is creepy. I'm gonna get away from him.
Okay.
While Hannibal, he can sift through anything. Even
I
at
think
the even at the end of the movie, he's having like a wig on, like just chilling in the tropics
Cuba.
somewhere.
Yeah, yeah.
You know?
I think
Like he's a chameleon. He can
this
go
is,
anywhere he wants.
This is my rebuttal: is that Hannibal, you're gonna be dead and you won't even know it. It's already over. But the other guy, he's gonna have you in prison in a tube in a hole. That would freak me out. Just kill me, get the shit over, cook me. But I don't know. Did Hannibal trap his people? I don't know.
But that's the thing. If he really doesn't like you for some
He's gonna
reason, I
fuck with
feel
you.
like Hannibal, he's gonna fuck with you,
Yeah.
and it's gonna be it's gonna
Really
be
bad.
way
He's gonna torture you.
worse. Yeah, and don't get me wrong. What Buffalo Bill's doing is torture
Yeah.
as well, obviously. But with Hannibal, he's thinking about that shit. With Buffalo Bill, it's just like it feels like an instinct. It's
Okay.
just natural to him.
I just feel like
Yeah,
it would be
I
over
feel like-
quicker.
No, I think both of you are right. I think Hannibal Lecter is more dangerous
Hmm.
because he's more
Yeah.
unpredictable.
True.
I think Buffalo Bill, I agree, he's more face value. Was she a great big fat girl? Like the voice, the dishevelment, the nipple rings, the mess of a makeup. Like you're gonna be like, that dude's creepy. If that dude hits on you at a bar, you're like, I'm going to my male friend and I'm I'm out. Whereas if Hannibal Lecter hits on you at a bar, you might be like, oh my God, you're a doctor? What kind of, like you might start talking to him and then you're like, you don't know when it's coming.
Yeah, now you're dinner.
I would be more scared. I think the Lecter is more dangerous and Buffalo Bill is more creepy.
Correct.
Yeah, I agree.
The creepy creeps me out. You gonna kill me, man? Let's get this shit over with, G.
Yeah, like Hannibal's not gonna just hit you over the head with a hammer and be done with it. Like he's gonna eat you.
But you probably be dead,
You're
or
dead.
like one guy was eating his.
Maybe.
They were eating the one guy's brain in the second movie, and he didn't even
he
know.
bit his nose off. He bit the guard's nose off.
True, but
He did bite his face off, yeah.
And
Yeah.
he fed one dude to pigs.
Yeah, okay, yeah, you're
But
gonna be tortured.
those were
I agree.
people
Buffalo
he
Bill
hated.
tortured. Like, but Buffalo Bill's victim in the movie, like that must
Yeah.
have been absolutely horrific.
Come
Being
on,
in that
man.
all down,
Come on,
knowing nobody
man.
hear
And then you're a
you.
woman, and
That's also, yeah, they're, yeah.
yeah, but
Good.
They're
maybe
both terrible.
people also maybe like Buffalo Bill because you can. There's a greater chance you get away
True.
with Buffalo
'Cause
Bill.
he'll
Where
fuck
Hannibal,
up.
you did.
Yeah.
He's more
Buffalo Bill
impulsive.
fucks up, right?
Buffalo
'Cause-
Bill fucks up. He's too impulsive. He's too erratic. He's
Yeah.
and he
too,
showed that his dog is his weakness, right? That's how she got the fucking dog.
Right.
Because she knew it was a weakness.
Right.
Right. With Hannibal, you have no idea what his
Agreed.
fucking are.
Agreed.
If you're just and you're not even a therapist, you're just a
Yeah.
normal
Yes.
person that doesn't know anything about anything, and he's talking to you. You don't know what
Nope.
his weaknesses are, even if you know he's a bad guy. You don't know what the fuck he's thinking or what he's gonna.
Well, and Lecter has the charm factor. Buffalo Bill does not.
No.
He doesn't have the charm factor.
So what I hear you saying is, women, if the guy's creepy, run, and if a guy's charming, run.
just run.
He's
Just run.
Run,
Yeah.
just run.
Yeah, just run.
That's the only advice you have for women on the podcast today is
Get your tracksuit on and just keep on
You know,
running.
date women. That's our only advice right now. And them bitches is crazy. So you're screwed there too.
Hey, get your best Nikes on and just keep running.
Just
girl.
run.
Just
Just-
keep-
Location on. Tell a friend. Take your own car, public place. I mean, and then
100%.
Yeah.
run.
Yeah.
Right. I mean, the only real good theory to stay away is you keep on running.
Was that Forrest Gump?
Yeah.
Oh my god.
I
that was
just keep
terrible.
running. You do his impersonation.
Jenny.
Wow.
See,
That's
I said one word.
But you gotta
That's good,
say
though. I
keep
feel like
running.
you.
Keep running.
That's
It's
good.
good.
You gotta have a nice draw.
Good.
Thank you.
Thank you.
Doctor.
Doctor.
Uh,
This was good. So Spence, before we forget, as we're wrapping up, do you
Yes.
have any comfort shows, or what's your favorite go-to
Yes.
comfort shows? A lot of folks are neurodivergent, anxiety, autism. We have a lot of things that we repeat over and over and over, such as music, shows, drawings. Do you have any comfort shows or movies? And if so, what are they?
I do, but I'm unwell because I
48
watch
hours and
true
shit.
crime. I only watch true crime.
Okay.
I mean, I used to come home. I used to work at Sing Sing. I don't know if you guys have heard of Sing Sing, maximum security prison in
New York.
Yeah, it looks like an old. It was built in 1820 something, and it has like skeleton keys to open the gates, and it looks like Shawshank Redemption. It looks like
Oh.
Shawshank. It's very intimidating. It's tiered up. You walk in, the inmates just scream. It's like a movie. And I used to come home from that and turn on like Forensic Files, and my mother used to be like, "Don't you get enough of this at work?" And it's like, no. I wake up and I turn on a true crime podcast. I then work as a forensic psychologist all day. And then to relax at night, I watch true crime. It's absolutely unwell, but I'm at the point in my life where I've completely accepted it. It's just, it is. And now I'm on a true crime show. So there's that. So I'm not going to give adequate advice to people in terms that's my relaxation. For me.
Okay. I just wanted to know what the comfort show was. The comfort, it wasn't advice.
no.
What's your comfort show?
Yeah.
I honestly feel like when, this is sarcasm, when you get murdered,
Yeah.
it'll be by your partner. And they'll be like a psychopath that you've been trying to like track and like, right? It's going to be magnificent.
There's no way. There's no way. And here's why.
Oh, here we go.
I feel like he's going to get you.
No, but how? I'm the expert on psychopathy.
But,
Like, how?
but you never expect it.
Exactly. You never know. He's gonna be like, "Hey,
No, but
babe."
then how will I fall for it if I know what psychopathy is?
But maybe he would find you as the challenge, and then you would be his masterpiece.
He would manipulate me to the point where I wouldn't even see it.
You
And
wouldn't
then
even see it. He would be such cloak and dagger, you'd never know.
Dexter got away with it for
Dexter,
years.
Dexter.
All right.
Yeah.
He was killing bad people, and he was still getting away
Yeah,
with
he was
that.
such a
I would
crazy-
love your show. Your show would be good. The
Thank you.
expert
I
fool.
appreciate that. It might be in the works, so let's hope for that.
Can you
The
imagine
Dr.
that though? Like
Haji
you could
story.
actually make that a magnificent show. You being this person that's tracking people and your partner's out doing all this wild shit, then eventually you figure it out and
I feel like they've made that show. I feel like
they
I've
probably
heard that.
have, but it wasn't an Indian woman.
Yeah, Indian, French, and Tanzanian.
I know.
Biracial
Well, I'm
woman.
not adding all
She's
that shit. You're lucky I didn't
biracial.
call you Mexican. Chill the fuck out.
I've been called Mexican, Cuban, Saudi Arabian, Puerto Rican, Dominican,
Yeah.
and I take and
So
none
many
of
races.
You're
It's just
brown,
not
you're
one of them's
Mexican in
correct.
America. In the 2025 America, I'm not going to say what 2025 and who, but you're Mexican. So
Oh,
that.
Jesus.
you're illegal.
Especially in your state.
Yeah.
Jesus. That's
Oh
a
my
terrible
God.
state. Yeah. Yeah.
So
Gosh. Well,
that was
once
kind of
again,
the ending of things. Any sauce you want to put on this, Doc? Anything you
I
want
think
to?
you guys are good with the sauce. I think
Tell
you
me we're
guys are
good.
really good with the sauce. I hope I'm employed still. No, I'm just kidding. No, this was amazing. I'm glad we picked Silence of the Lambs.
yes.
That was a good one. You guys had some really good options. I was going back and forth, but I was like, huh, Silence of the Lambs, because as soon as I saw that movie, I was like, oh, I'm gonna be Clarice. So, you know, I like to think I'm the real life Clarice, except she was cooler because FBI is cool, you know.
Yeah.
But
Can't
that,
beat Jodie Foster,
yeah,
Jodie
Jodie
Foster.
Foster. She's awesome. She's untouchable. I get it. But yeah,
All right.
I appreciate.
All right. Well, hey, just want to say thank you so much, Dr. Haji, for staying with us for 2 parts. You stayed for a sequel, your most hated thing of all time.
There you go.
You
Right?
stayed for it
You know.
and you did it. You lived it. You lived a sequel.
did.
Look
I
at
did.
that.
She needed it.
Yeah, thank you once again. Just want to say you can come back anytime, pick any show, movie, whatever you want.
Musical.
Your favorite musicals. Yeah, yeah. West Side Story, here we come.
The ones that make you want to murder people. I was going to be more vulgar. I'm going to stop. Continue,
Yep,
Spencer.
there you go. And that's how we end the show. But yeah, just want to say thank you again. I'm Spencer. That's Nas, Different Spectrums Podcast.
All right, everyone. Much love for hanging with us even longer for the second edition. Remember, take care of yourselves.
Or don't.
It's completely up to you. Peace.
Deuces.
Tell me what you